Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a gynecologist talking to a patient called Miss Reyes. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Miss Reyes. Your GP referred you to me based on some symptoms you've been experiencing, right?
Yes, that's right.
I've looked over your GP's notes, but it would be helpful if you could tell me in your own words what's been bothering you.
Well, it started with really painful periods which have just gotten worse over time. It's like this deep, constant pain in my lower abdomen. I thought it was just part of getting older, but it's been almost unbearable some months.
That sounds distressing. Has this pain affected other aspects of your daily life?
Yes, a lot. I sometimes have to take days off work because of the pain, and I don't know if this is related, but I've started having more frequent, heavier periods too. I'm often exhausted from it, and I'm always worried about bleeding through my clothes. It's really affecting my confidence.
I understand. Managing work and daily tasks must be challenging with symptoms like this. Are there any other symptoms that have been bothering you?
Yes, actually. Lately I've been feeling really bloated, like all the time, even when I haven't eaten much. And sometimes it feels like there's this heavy pressure in my lower stomach. It's like my abdomen is constantly swollen.
Bloating and pelvic pressure can certainly be linked to what you're experiencing. Do you feel the pain in your lower abdomen outside of your menstrual cycle as well?
Yes, sometimes it's there even when I'm not on my period. It's a dull, aching pain most of the time, and I have these sharp, stabbing pains too. Even sitting or bending can feel uncomfortable.
And how long have you been noticing these changes?
About a year, but it's gotten a lot worse in the past few months. I mentioned it to my GP, who thought it might be endometriosis at first, but here we are.
It's good you've come to see me. Given your symptoms, we're going to explore the possibility of adenomyosis, a condition that can cause many of these symptoms, especially intense menstrual pain, heavy bleeding, and pelvic pressure. Are you familiar with it?
I've heard the name, but don't know much about it. What is adenomyosis exactly?
Adenomyosis occurs when the inner lining of the uterus grows into the muscular wall of the uterus. This can lead to painful cramps, heavy bleeding, and that feeling of pressure or heaviness you mentioned. It's similar to endometriosis, but in adenomyosis, the tissue is located within the uterine wall itself.
So, is that why I'm in so much pain? Because the tissue is somewhere it shouldn't be?
Exactly. As this tissue thickens and breaks down each month, it can cause inflammation and pain, especially during your period. Over time, the uterus can even become enlarged, which could explain the bloating and pressure you feel.
That makes sense. I was wondering why my abdomen feels so tender all the time. Is there anything I can do to make this better?
There are several options to help manage the symptoms. I'll outline a few, and we can discuss what might be most suitable for you. Initially, we can try anti-inflammatory medications to reduce pain and discomfort, and hormonal treatments like birth control are often helpful in managing heavy bleeding and cramps.
I'd definitely like to try something like that. Just knowing there are options helps.
Certainly. For some women, a type of medication called a GnRH agonist may be prescribed to temporarily relieve symptoms. It stops the body from producing certain hormones, which can reduce the effects of adenomyosis.
Okay. And what if these don't work?
If those options don't bring enough relief, we could discuss surgical procedures. One option is an endometrial ablation, which removes the lining of the uterus, but this is typically for milder cases. Another option is a hysterectomy, which is the complete removal of the uterus. We reserve this for severe cases where symptoms significantly affect quality of life and other treatments haven't worked.
That sounds a bit overwhelming. Are there risks with a hysterectomy?
It's completely understandable to feel that way. A hysterectomy is indeed a major procedure and is typically a last resort. However, it's often very effective for adenomyosis. We'd go over the risks and benefits thoroughly if it ever came to that point.
I see. What about less invasive ways to find out if I have adenomyosis?
Great question. We can start with a pelvic ultrasound to see if the uterine wall appears thickened, which can suggest adenomyosis. In some cases, we may also do an MRI for a more detailed view. These non-invasive methods can often provide us with the information we need.
That sounds better. So, if it's confirmed, would treatment reduce the risk of other issues?
Absolutely. While adenomyosis itself isn't dangerous, if left unmanaged, it can lead to complications like severe anemia from heavy blood loss. Effective treatment can greatly improve your quality of life and reduce these risks.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Elliot. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Elliot. I've reviewed some of the notes from your previous visits, but since this is our first meeting, could you start by telling me about the sleep issues you've been experiencing? When did you first notice the difficulty with sleeping?
Good morning. Sure, it started maybe, I'd say almost a year ago. I thought it was just a few bad nights here and there, you know? But then it just kept happening. I find it so hard to fall asleep, and even when I do, I wake up multiple times. By morning, I feel like I haven't slept at all.
That sounds really tough, Elliot. Let's break this down a bit. Would you say the difficulty is more with falling asleep, staying asleep, or do you find yourself waking up much earlier than you want to?
It's mostly falling asleep initially. I am just lying there for hours, and even on the nights when I do fall asleep faster, it's so light. I wake up at the slightest noise and can't seem to get comfortable again.
Understood. Insomnia often has a variety of contributing factors. Have you noticed if it's connected to anything specific like stress, any changes in your daily routine, or perhaps certain foods or drinks?
Definitely stress. My job's been very demanding lately. I think about it even when I'm in bed, going over everything I need to get done the next day. I try to switch off, but my mind just keeps going.
That's actually very common with insomnia. Our minds can stay in work mode even when we're trying to rest. Have you tried any relaxation techniques to help slow things down before bed, like deep breathing exercises or meditation?
A bit of meditation, yes. But honestly, I struggle to focus on it. I'll try to count my breaths or follow a guided meditation, but after a few minutes, my mind just starts racing again. I've also tried cutting down on caffeine, and I don't drink it in the afternoons anymore.
That's a good start, Elliot. Cutting down on caffeine and trying meditation are both positive steps. Sometimes it can take a while for the mind to adjust to relaxation techniques, especially if it's been in an overactive state for a while. Do you mind if we talk a bit about your bedtime routine? Things like screen time or activities you do in the evening?
Oh, I'm sure my screen time is an issue. I'm usually on my laptop until late, finishing up work emails. After that, I'll often watch something on my phone in bed, hoping it'll help me relax, but I've read somewhere that screens can make it worse.
Yes, screens can be a big factor. The blue light emitted by devices can interfere with melatonin, the hormone that helps us feel sleepy. Even though it may seem relaxing, it can actually stimulate the brain. We can discuss some ways to shift that evening routine. For instance, setting a screen cut-off time might help you wind down more naturally.
That makes sense, but I feel like I'm still going to be lying there, unable to sleep. It's been going on so long now that I almost expect to have a bad night. I'm even anxious about bedtime sometimes.
That's actually quite common, and it can create what we call a cycle of insomnia. When we worry about not sleeping, it increases adrenaline and tension, which can make sleep even harder to achieve. One approach that can help is sleep conditioning, where you train your body to associate the bed solely with sleep and rest. That might mean avoiding activities like watching TV or working on your laptop in bed.
I'd like to try that. I've been feeling the effects of this so much more lately. I struggle to focus during the day, and sometimes I'm so tired that I feel a bit detached, if that makes sense.
Absolutely. Prolonged insomnia can lead to concentration issues and even a sense of being disconnected. It can really impact daily life. It's also good that you're aware of these changes. Sometimes, creating a structured sleep routine can help to get your body back in rhythm. We could even try adjusting your sleep schedule slightly, going to bed, and waking up at consistent times can help reset your body's internal clock.
I'll try to set up a more regular sleep schedule. But I wonder if there's anything else I should be doing, like a natural supplement or something.
There are some over-the-counter options like melatonin that can assist in resetting the sleep cycle. However, it's most effective when used under guidance, as timing is crucial. ID also suggests limiting caffeine and alcohol, as both can interfere with sleep quality.
I don't drink much alcohol, but cutting back on caffeine even more might be helpful. What about exercise? I used to go for a run in the evening, but I stopped because I thought it might be keeping me awake.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a GP discussing with a sleep specialist. Now read the question.
I wanted to consult with you about a patient experiencing chronic insomnia. He's been struggling with it for several years and hasn't seen any improvement.
Ah, insomnia that's resistant to both therapy and medication?
Exactly. Behavioral therapy didn't work, nor did the prescribed medication.
I see. Did you observe anything significant about his lifestyle that could be affecting his sleep?
Not specifically. He leads a fairly regular life without significant stress.
That's interesting. I've noticed that sometimes underlying health conditions, such as sleep apnea or restless leg syndrome, can go undetected and exacerbate insomnia. Perhaps an overnight sleep study could reveal more.
That might be helpful. I'll recommend that as the next step.
Now look at question 26. You hear an intern reporting to an orthopedic surgeon. Now read the question.
He reports swelling and instability in the knee but no visible deformity. He has difficulty bearing weight and describes occasional locking sensations. The injury occurred 2 days ago, and he's been icing it since then.
What do you recommend as the next step?
Based on the patient's symptoms and history, I recommend an MRI to assess for potential ligament damage, especially considering the instability and locking of the knee. This will help determine whether surgical intervention or physical therapy is required.
What are the common findings in sports-related knee injuries like this?
Common findings include ligament tears, meniscal injuries, or cartilage damage, depending on the mechanism of the injury.
Now look at question 27. You hear a pediatrician's perspectives. Now read the question.
Well, it has always been my goal to work with children and build strong, supportive relationships with their families. I truly believe that understanding a child's family environment and history allows me to make a lasting impact on their health and well-being. Running a pediatric clinic comes with its own set of challenges, including hiring the right staff, organizing the clinic's day-to-day operations, and ensuring we have enough resources for every patient. But I quickly realized that balancing patient care with the clinic's financial health is the hardest part. There's a constant struggle between giving each family enough time to address their concerns and seeing enough patients to keep the clinic sustainable. I am currently thinking about expanding the team to share some of these responsibilities, which I believe is essential too.
Now look at question 28. You hear a pharmacist clarifying with a doctor. Now read the question. Sorry to interrupt, Dr. Wilson. I just wanted a quick word about Mr. Lee's prescription. The one for amlodipine that you prescribed a couple of weeks ago.
Ah, yes, for his high blood pressure.
Right. So he's been taking 10 milligram tablets daily, as instructed. The thing is, he was in the pharmacy today, and he mentioned that he's been having some dizzy spells and feels faint occasionally. It seems his blood pressure may be getting too low.
That can happen, unfortunately. Maybe adjusting the dosage could help manage that.
Okay. I will explore some adjustments, and then I will confirm the changes with you.
Sure, sounds good. Thanks.
Now look at question 29. You hear a nurse talking to her colleague about whether it's appropriate to give a patient medication to help them sleep better in the hospital environment. Now, read the question.
Mr. Lawson has really been struggling to get any decent rest.
I know, and he's mentioned how the noise here keeps waking him up throughout the night.
He does have a lot of trouble drifting off, and every time he stirs, it takes him ages to settle back down. But that doesn't mean medication is the right option.
He's really worn out, and I think he just needs a solid night's sleep. We want him to recover, after all.
Absolutely, but we can't risk him becoming dependent on sleep aids. Even if he's tired, I really think it's best to explore other ways to help him sleep better.
I am happy to sit with him or bring in some earplugs if that would help.
I would actually prefer that over medication for now. We don't want him relying on it when he's not used to it.
Now look at question 30. You hear two nurse managers discussing ways to improve staff morale on their unit. Now read the question.
Several team members. It seems that the stress levels have been exceptionally high lately, and it's starting to affect everyone's morale.
I've noticed that too. We have been dealing with staffing shortages and increased workloads for weeks. We really need to focus on team building and creating a more supportive environment.
Agreed. But the tricky part is finding time to work on these improvements. Have we organized any workshops on stress management or communication skills recently?
No, it's something I wanted to discuss with you. I think we need to make it a priority, but it's been hard to schedule anything with the current demands. Maybe we can delegate some of these responsibilities or adjust our schedules.
That's a good idea. And maybe we could set aside a time each week for team check-ins. I will bring it up with the director and see if we can start with small steps.
Definitely. Let's try to move on this before we lose more staff. High turnover will only make things worse for everyone involved.
I will get on it right away.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Dr. Laura Kelly. You now have 90 seconds to read questions.
Migraines and headaches are extremely common and can be debilitating for many people. Recently, Dr. Laura Kelly led a trial to explore management strategies for both conditions. Dr. Kelly, could you start by explaining how migraines differ from other types of headaches?
Certainly. A migraine is a specific type of headache with distinct symptoms, often including severe throbbing pain on one side of the head, nausea, and sensitivity to light and sound. It's typically classified as a neurological condition, rather than a basic headache, which can be caused by muscle tension or sinus issues. In fact, migraines can last from a few hours up to 3 days, and, in severe cases, interfere with daily life much more significantly than common tension headaches.
Are there any common triggers or patterns that you see among people who suffer from migraines?
Yes, many people report specific triggers, though they can vary widely. For some, it's related to stress or lack of sleep, while for others, it could be certain foods, like aged cheese or processed meats. Even caffeine intake can play a role. Women are often more affected, and there's evidence suggesting hormonal fluctuations around menstruation can trigger attacks. Other common triggers include bright lights, strong smells, and weather changes. However, pinpointing exact triggers can be challenging, and it often requires keeping a detailed headache diary over time.
Interesting. So, in the study you conducted, what management strategies did you explore?
We had our participants divided into 3 main groups. The first group was given preventive medications commonly prescribed for migraines, such as beta blockers or certain anti-seizure drugs. The second group received non-pharmacological interventions, including cognitive behavioral therapy or CBT, along with lifestyle advice on diet, sleep, and hydration. We call this the holistic management group. The third group was instructed to make no changes initially, adopting a wait-and-see approach to gauge if their condition would improve over time.
And I understand you focused on something called trigger management in one of the groups.
That's right. We found that understanding and managing triggers is crucial in migraine treatment. The holistic management group was coached on avoiding or reducing triggers as much as possible, whether it was dietary, environmental, or related to their routine. For example, we encouraged regular sleep schedules and reducing screen exposure before bed. It's a bit like teaching someone to recognize patterns in their own condition, giving them a sense of control, rather than feeling overwhelmed by unpredictable attacks.
So, what were the findings in terms of effectiveness among the groups?
The results were very telling. For the first month, those on preventive medication reported the highest decrease in migraine frequency. However, by 3 months, the holistic management group reported nearly the same improvement, and interestingly, after 6 months, both the medication and holistic groups had similar results. But those in the holistic group reported feeling more empowered and better able to handle their migraines independently. The wait-and-see group showed some natural improvement, but it wasn't as significant.
Based on these results, what would you recommend to someone struggling with migraines?
For anyone who's experiencing migraines for the first time, I'd recommend they start by tracking their patterns and lifestyle factors to identify any triggers. If the migraines persist, they may want to explore holistic strategies, particularly those focused on routine and trigger management. Preventive medications can be highly effective, but are usually considered after lifestyle changes have been tried. And of course, in severe cases, a combination of both medication and lifestyle strategies may be necessary.
Extract 2. Questions 37 to 42. You hear Dr. Nolan Spencer giving a detailed presentation on patient autonomy and shared decision-making in healthcare. Now, read the questions. You now have 90 seconds to read questions.
Good morning. I'm Dr. Nolan Spencer, a clinical ethicist and professor of medical ethics. Today, I'd like to talk about a crucial aspect of patient care that is often underestimated: patient autonomy and shared decision-making in healthcare. Let's consider a case study. A 58-year-old woman with chronic kidney disease needed to make decisions about her treatment options, specifically whether to begin dialysis or manage her symptoms without it. She was initially inclined to follow her doctor's recommendation for dialysis, assuming it was the best route. However, her healthcare team encouraged her to fully understand all her options, including the potential risks and quality of life implications for each choice. After several discussions, she ultimately decided against dialysis, opting instead to pursue lifestyle changes and symptom management that aligned with her personal values and goals. This decision, shaped by her preferences, exemplifies the power of patient autonomy when patients are informed and involved. Shared decision-making is the practice of engaging patients actively in their own healthcare decisions. This model of care ensures that patients are not merely recipients of medical advice, but rather partners in their health journeys. Evidence has shown that when patients are more engaged in the decision-making process, the outcomes are often better, not only in terms of physical health, but also in mental well-being. When patients feel empowered, they're more likely to adhere to their treatment plans, leading to better health outcomes. I've written extensively on this topic, including a book called Choices in Medicine, which explores the ethical foundations of autonomy and shared decision-making. One chapter delves into the dilemma many doctors face, balancing professional expertise with respecting patients' right to make their own choices. Surprisingly, I've had readers share personal stories of feeling more connected to their treatment plans after reading about these principles. They often mention that understanding autonomy allowed them to feel a sense of control, even in vulnerable health situations. In some cases, they reported stronger bonds with their healthcare providers because they felt genuinely heard and involved in their care. It's important to note, however, that shared decision-making has its challenges. Take, for example, cases where patients refuse a potentially life-saving intervention. I once worked with a patient who, despite knowing the benefits of a recommended surgery, chose against it due to fears about the procedure. While his choice was respected, his decision had serious consequences that might have been avoided had he agreed to the surgery. This is where a fine line exists, as doctors want to guide patients towards the best outcomes, but must also respect their autonomy. An important part of the decision-making process is transparency. Studies show that when doctors explain potential benefits, risks, and alternatives in an unbiased way, patients are more likely to make decisions they're confident about. Transparency builds trust, a cornerstone of effective healthcare relationships. For example, in the chronic kidney disease case, by presenting the patient with all options and letting her weigh them based on her values. Her team allowed her to make an informed choice that reflected her priorities. Shared decision-making can also prevent unnecessary medical interventions, which may lead to better outcomes. When patients understand that they have the right to ask questions, express concerns, and even say no, they can make informed choices that avoid overtreatment. There's significant evidence suggesting that shared decision-making reduces patient regret and increases satisfaction, two critical measures of healthcare quality. However, reliance on shared decision-making also presents some risks, particularly if patients misinterpret information or lack adequate support. In a recent case, a patient with a heart condition declined medication after researching side effects online. Despite the physician's recommendations, the patient's choice led to complications that could have been mitigated with treatment. This scenario highlights a drawback of autonomy. Without accurate information and guidance, patients might make choices that aren't in their best interest. To me, one of the most important benefits of shared decision-making is the sense of partnership it fosters. When healthcare providers engage in open conversations with patients, it reinforces a model of care based on respect and understanding. This approach acknowledges that patients' values and preferences are essential to their treatment, making healthcare feel more humane. I remain hopeful that as shared decision-making becomes more integrated into healthcare, patients will feel increasingly empowered to make decisions that truly align with their lives and values. For now, while we continue to pursue advancements in medical technology and evidence-based practices, it's essential that we don't lose sight of patient autonomy. Involving patients fully in their own care doesn't only enhance their satisfaction, but it can also lead to healthier, more sustainable outcomes in the long run. The principle of autonomy is fundamental in making healthcare a collaborative, respectful, and patient-centered practice.
That is the end of Part C. You now have 2 minutes to check your answers.